Good afternoon. I'm Brooks Keel, the president of Augusta University, and it's a real pleasure to be with you here this afternoon. We've got a lot of information to share with you today. We've got a large number of questions that we're really excited to see. We're going to try our best to provide you with answers. Our goal is to communicate with you as often as we possibly can to keep you informed about what's going on across our campus and across our health system. So again, we're just delighted to have you here today, and we welcome your feedback. So if you know of ways we can better communicate with you, please tell us. Please let us know, and we do everything we can to do just that. I've got some material to show you here today, some slides, and I want to go ahead and get started on that if we can. And again, just welcome here. We've got some guests I'll be introducing a little bit later in our program today that I think will provide you with the expertise and I'll answer to your questions that you need. We've heard the term new normal for a long time now. At least it sure seems like a long time. It's really only been about 10 months. And what that means now, what it means in the future, I think we're all struggling with, trying to determine what that's going to look like. What's the post-COVID world going to look like? What is our new normal now, and what is it going to be later? But instead of the new normal, I think in many cases it's often best to start talking about the now normal, because this changes on a moment's notice. We have all experienced that. We've experienced that since the middle of March when we reported our first case here in the health system. And we're going to be experiencing that for the foreseeable future, certainly as we get through this calendar year. Things are going to change. We've got to remain flexible and nimble and adjust to that change as we move ahead. So I think in many ways, perhaps the now normal is a better way to describe things, because at least it keeps in my mind front and center that we got to take today as it is, and we will adapt and change as tomorrow presents new challenges for us. Before we get started, I want to take just an opportunity to give a heartfelt and a huge amount of gratitude and thanks to Dr. Zach Kelleher for all the great work he has done as the interim provost. Zach, I hope you're looking today. If you are, please know that there's no way we can thank you for the great work that you did. You stepped in right into the deep end of the pool with very little notice and warning, and you took the role of interim provost by the horns and did just a fantastic job. We have a resolution that I'm going to read very briefly. We'll have it framed and ready for you as a small token of our appreciation. But for now, if you would let me just read this, and then I know all of our colleagues across the system will be quietly clapping and congratulating you. Whereas Dr. Zach Kelleher, Vice Provost for Instruction at Augusta University, has served as the interim provost and the executive vice president of academic affairs since August 31, 2020. And whereas Dr. Kelleher has imparted humor, compassion, and joy to his colleagues and students in a truly unprecedented time marked by a worldwide pandemic and the retirement of a 30-year incumbent. And whereas Dr. Kelleher's service as provost exemplifies the best of leadership, imagination, and courage, and is marked by some of the university's most monumental successes, including record-breaking student enrollment. And whereas Dr. Kelleher is an educator with more than 35 years of classroom and administrative experience, and whereas Dr. Kelleher joined the university in 2015 as Dean of the College of Education and served in that role for 3 years, before being named Vice President for Instruction and Innovation and later Vice Provost and Interim Provost. And whereas Dr. Kelleher has authored a number of leadership books and has made many other scholarly contributions to the field of education and leadership. And whereas Dr. Kelleher is the recipient of the Inspirational Teaching Award from the University of South Carolina, the Meritorious Teaching Award from Furman University, the Summa Teaching Award, and the Teacher of the Year Award from the Dunwoody High School, where he held his first teaching position. And whereas Dr. Kelleher is a respected colleague, a competent administrator and teacher, held in the highest regard by his peers and students, now therefore be it resolved by the Office of the President of Augusta University that the President bestows upon Dr. Kelleher the university's sincere gratitude and appreciation for his service. Furthermore, the President directs that this resolution shall be documented with the University System of Georgia Board of Regents, and a copy shall be provided to Dr. Kelleher. Zach, we are so grateful to have you here, and I think perhaps more importantly than that, we're delighted that you aren't going anywhere. You're still going to be here contributing to this great university. And I know our new provost shares with me the joy of being able to work with you as we move forward. So thank you so much for all of us at Augusta University for your dedication to this institution and to the field of higher education. Thanks, Zach. And we have a new provost. As many of you know, Dr. Neil Mckinnon joined us actually earlier this week. I think he started his formal first day. He is with us here today, and I've offered him an opportunity to say a few words to you. And so I'll turn things over to Neil, and if it takes more than an hour and a half, we're going to have a conversation. But anyway, I'll turn things over to him and let him say a few words to you.
All right. Well, thank you, President Keel, and thank you to the AU community for your warm welcome. This is day number 4 for me, so I don't have a ton of insightful things to add to the conversation. But I suspect many of you might just be wondering, what exactly is a provost? You might have heard the word. Perhaps this actually is the first time you've ever heard of a provost. Perhaps you didn't know that AU actually had a provost. Well, the provost is the chief academic officer of the university. He or she oversees the colleges, the schools, things such as student success. And here at AU actually has an expanded role overseeing other things such as research, diversity, equity, and inclusion. So it's an important role at the university, one that I'm thrilled to join President Keel and his team. And when I interviewed, it was made obvious to me very quickly what a special place this is. AU really is a jewel of the region. And I would argue perhaps an unknown jewel to many. And so part of my role, I think, is to increase the visibility. And the provost also really is the chief advocate of the academic enterprise of the university. And so part of my role, again, will be spreading the word of the good things that the faculty, the students, and the staff and alums are doing. One way that I can do that is really to listen. In the next 3 to 4 months, I'll be spending a lot of time listening. I'll be touring every single college and school, doing one a week, starting on Monday at the Medical College of Georgia. So if you're a faculty, staff, or student, you should be seeing me in your college or school. I've also asked the deans if I can have an opportunity to teach the students in each college and school as well. And also, President Keel also agreed that I could keep a small research program to serve as a role model. And actually, just this morning, found out I'm a co-investigator on a new grant. And being, of course, one of 4 research universities of the university system in Georgia, it's a special role that we play. So in summary, I'm thrilled to be here. I love Georgia already much better than Ohio, President Keel, in January. And again, look forward to working with you and helping achieve your vision for the university. Thank you.
Thank you very much, Dr. McKinnon. And again, we're delighted to have you here. And believe me, having lived in Kansas for 16 years before I moved south, the greatest thrill of your life is actually burning that snow shovel, which I hope that you and your family have an opportunity to do. There are a lot of topics I want to cover, so we're going to go through these quickly, and hopefully it'll give you the information that you need, but give us time to cover everything. We have been very conservative in terms of our budget. As you know, we were faced with a 10% budget cut going into this fiscal year, and I applaud our entire enterprise for being frugal in terms of performing that budget cut. We wanted to wait until the amended budget came in to determine if there were going to be additional cuts, and I'm excited to tell you that due to the wonderful work that our state has done and the leadership that our governor has shown the state of Georgia, we are not going to be looking at any additional budget cuts. In fact, there will be some new money we are anticipating that will come to Augusta University. We do not know yet what that will be. The Board of Regents will make that determination over the coming weeks to a month or so. But I just wanted you to know that we will be getting some relief. I don't know what that means right now. I hope that you don't automatically assume that your budget cut will be restored. We will not be able to do that, but we are going to be able to make some strategic investments, I think, in all the great things that we do here moving forward. And I've already begun to engage Provost McKinnon in that. And so please stay tuned for that. Bottom line is really good news, no additional budget cuts. We have a strong state. And we are very optimistic going into the remainder of this fiscal year and into the beginning of the next fiscal year as well. We're back to school. We started the school. We're finishing up our second week of class, and clearly our classrooms don't look anything like they did a year and a half ago, or certainly a year ago. And we know that. But we are committed to an in-person education. Well, we are committed as Augusta University. We're committed as University System of Georgia. And although our classrooms look differently, we still are able to provide that face-to-face instruction our students demand and deserve. And that is only due to the incredible work that primarily our faculty, but also the staff that support them, have done to, in the face of a pandemic, to completely change the way in which we provide education, to provide the students this. So I'm incredibly grateful to all of our faculty and staff for the great work that you have done in the classroom. I want to provide you with a real quick update in terms of where we are with COVID-19. And I want to start by saying, it was March 13th, the picture that you see there when I had and the leadership team had a chance to visit the laboratory of Dr. Coley in our university here, who had developed the first COVID-19 test, the first in the state of Georgia that wasn't associated with the CDC or the Department of Health. Truly phenomenal work and a great testament to what you'd expect being the state's only public academic medical center. And we approached COVID testing there in the middle of March through a three-pronged approach that involves screening and scheduling patients to be tested, and involves sampling in a safe and convenient way, and involves actual testing itself. And so let me just give you an update on where we are and what the great work that our folks in the health system have done to get us to where we are today. First, in terms of screening, at the beginning of the pandemic, we were able to offer a live telehealth app 24 hours a day, 7 days a week, that started here and then actually was at the request of Governor Kemp taken statewide. It allowed us to provide patients with direct access to advice from a healthcare provider and to schedule a COVID-19 test. To date, it's hard to believe the actual numbers that our folks have been involved with, but we've had a total of 110,921 contacts. Some 20,000 telemedicine visits. We sort of ended that in the middle of the summer as we went strictly to just hotline calls, an additional 90,800 hotline calls, as I say, for a total of almost 111. This is an amazing feat that our folks have done to try to have direct personal contact with our patients to get them scheduled for a test. Of course, once you get the test scheduled, you need to go someplace where you can have the sample taken. We were one of the first in the regions to develop a drive-through testing facility that provided not only convenience for our patients, but also safety and convenience for our staff as well. We started out at Christenberry Fieldhouse, as many of you know, and then as the weather turned typical temperatures you see in Georgia in the summer, we moved to the annex and are still doing testing there even as we speak. Our dental school tremendously stepped up to the plate and began manufacturing the actual sampling swabs that we use to collect the samples for COVID-19 testing, and have been actively involved in providing that access for us as well. This is a busy graph, and I'm going to show you just a little bit of data. But this shows you the actual number of patients that we have sampled every day since we began doing this back in March. The black dot shows you that actual sampling number. The blue line, if you can see it there, is the 7-day rolling average. You can see some variation toward the latter part of our sampling process, and this is due primarily to taking some days off during the week, whether we actually had no patients at any particular site, to give our healthcare providers some rest. But we are on average doing upwards of 800 tests a day, on average, every single day. And what a tremendous feat our staff have done. To date, we've done over 148,000 sampling, provided those specimens to our lab for testing, and that is an amazing feat. Once you get the sample, obviously it needs to go to a lab to be tested, and we're so incredibly fortunate that we have that lab right here at our AU Health System, state-of-the-art polymerase chain reaction testing. To date, in that lab, we've done just over 150,000 COVID-19 tests. This graph shows you the percent positivity, which is a pretty good indication of the prevalence of the disease in our community. The green dots show you the percent positive for that day of testing, and the black line shows you the 7-day rolling average. And as you can see, the percent rate has been increasing over the past several weeks to months. The good news is, if you look all the way to the far right, that black line appears to be trending down. Pay attention to that trend that you see there, because we see it in other metrics as well. And we are holding our breath, hopeful that we may begin to see a plateau and hopefully a downward trend of cases, percent positivity rates, and other aspects as it relates to COVID-19. Over 150,000 tests is remarkable. So where are we today? That's a lot of work has been done over the past several months. Where are we today with regards to COVID-19? It's been 313 days and counting since we first reported the first positive patient here at our AU Health System. I remember that day as actually very early in the morning, just after midnight when the test results came in from our lab. And we had right in front of our face the reality that COVID was among us. 313 days later, we're still dealing with this. And I can't tell you how proud I am of all of our healthcare providers, our frontline healthcare providers, our doctors, our nurses, our technicians, our support staff have just done yeoman's work throughout this whole pandemic. We have a lot to be proud of and a lot to be grateful for because we have, as part of our campus and academic medical center, and that is something that the other 25 campuses of the University System of Georgia can't say. What an incredible benefit that's been to us as we have moved ahead. People wanted to know how does that affect our campus? How many students are positive? How many of faculty and staff are positive? And you can see the results here. This is the weekly numbers. The green bars represent the students, the number of students. The blue bars represent the number of faculty and staff. That black vertical line that you see going up and down, that's the end of the fall semester and the beginning of the spring semester. And as you can see, the first 2 weeks in the spring semester, we did have an uptick in cases. So this is not to be unexpected because we knew that as our students and faculty and staff came back from the Christmas holidays, we were going to see an increase, and in fact we have. But the good news is we're already beginning to see a downward tick on that. The number of student positive have been in the 50s for the last 2 weeks, and I just got the report as of noon today, I believe it's 39. So we're beginning hopefully to trend down on that as well, and we're thankful certainly for that. To me, this graph showed, it really gives us an idea of the severity of the COVID-19 and the prevalence of it within our community at least, the severity of the prevalence, if you will. This shows you the number of COVID-19 positive patients we have in our hospital every day, which is the red line, red dot, since middle of March, and the black dots represent the 7-day rolling average. And you can see that, you can see basically 3 phases. We had one phase that started in around the April time frame, and we had 29 patients in the house, and we were marveling at how we were going to be able to handle that. Then we saw another phase back in the middle of the summer, and for almost the entire month of August, we had somewhere around 70 patients a day, COVID-19 positive patients in our hospital. More recently, that has skyrocketed up to 100. And over 100. And we have been wondering, when are we going to start seeing a downturn there? I'm excited to tell you, and we're, again, very guarded about this. We want to be optimistic, but guardedly so. It looks like there may be a downward trend there. If you look to the far right, that black line, 7-day rolling average, is beginning to decrease. This is as effective yesterday, and I've just learned that we now have gone from triple-digit numbers down to double-digit numbers, so we're in the mid to high 90s now in terms of in-house census, and we're very hopeful that that certainly will continue. If you want to know what's going on in the state of Georgia, this shows you the results from their website. This is effective as of yesterday. The left part of the graph shows you the percent positive rate for the state of Georgia, and the right part of the graph shows you the actual number of cases in Georgia. And if you look at that 7-day rolling average, which is the yellow line, and compare it with our information, this shows you Georgia percent positives on the left and AU Health System percent positive on the right. The actual values are going to be different, of course, but the trends are very similar. You can see the downward trend on the right-hand side of the Georgia percent positives. You see that on our percent positives as well. And the same thing can be said for the number of cases that we see. On the left, you see the number of COVID-19 cases in the state of Georgia, and you see that fall, that downward trend on the far right. We're excited about that, and it sort of mirrors what we're beginning to see here as well. So what we see in the health system is fairly consistent with what we see across Georgia. The actual time may be slightly different, but it's very consistent. Folks, there is light at the end of the tunnel. And I think we can conclusively say that now, and we can say that because of the availability of COVID-19 vaccines. a tremendous amount of excitement about this and what this means for us. And we are also taking a leadership role in getting this vaccine to our faculty, our staff, our patients, and the family members of all of those individuals. And just like we played a significant role in the state of Georgia for COVID testing, we also expect to play a significant role both in the CSRA and the state of Georgia with regards to COVID-19 and its availability. Just very briefly, many of you probably know that right now we have 2 vaccines that are available, one made by Pfizer, one made by Moderna. They each have different storage requirements. The Pfizer has a storage requirement of minus 80 degrees centigrade. That's extremely cold. Moderna is minus 20 degrees centigrade. Each requires 2 doses, an initial dose, and then either 21 for Pfizer or 28 days later for Moderna, a second dose. What all that means is that the logistics of administering the vaccine is extremely complicated. The sheer scheduling of individuals, when you have 2 different time frames you have to worry about, 2 different doses you have to worry about, has become very complicated. But I'm excited to tell you that we are gaining a tremendous amount based off the experience we had from the logistics of doing COVID-19 testing. And our folks have again stepped up to the plate and done a masterful job in terms of vaccine administration. Both vaccines are approximately 95% effective. Both have typically have mild to no side effects, which may include fatigue, headache, muscle or joint pain, and to date, no serious adverse reactions that we're aware of. And Dr. Keel is with us here. He'll be able to provide some more insight into that in just a few minutes. The biggest question, but there are 2 actual big questions we have is how quickly are we going to get the vaccine? What's the distribution like to us? And when we get it, who gets the vaccine and when? And I just wanted to show you, these are the guidelines presented by the Department of Health. Many of you probably have heard of Phase 1A and Phase 1B. We are currently in Phase 1A+, which is provided mostly to healthcare providers, to long-term care facilities, to adults 65 years of age and older, and that's a real important component for us because we're really focusing on the population of 65 and older. And this is not just unique to Georgia. We're focusing on that across the country. And then other individuals, law enforcement, and first responders, et cetera. We are now still in Phase 1A+. We as an institution, we as a state. The state has determined, the latest information I have, is that the state will simultaneously move to Phase 1B, and that will allow us to begin to start focusing on essential workers, which we include all of our educators and other individuals that were not included in the Phase 1A+. And then later in this year, we'll move to Phase 1C, which now gets us to younger individuals. We are going to follow, to the very best we can, the Department of Health vaccination prioritization guidelines. But our goal is to get as many shots in arms as absolutely possible. Folks, there's no doubt that we may have vaccinated some individuals. They may appear to be out of order of priority. But believe me, there are a lot of rumors out there. So please don't necessarily believe every single thing that you hear. We will continue to do all we can to vaccinate every one of our AU faculty, staff, and students as soon as we possibly can. But please remain patient as we try to balance supply and demand. There just isn't enough vaccine available right now to meet the demand that we're seeing. In some ways, that's a good thing. But we're working with our governor and with the state to try to make sure that Georgia gets this allocation as quickly as we can. And once we do, we're going to get it in the arms of you as quick as we can. Dr. Keel can, again, provide more information on this, but we are going to use a scheduling system. We've already begun trials on that to get the kinks worked out. But please, if you are scheduled, when you do get scheduled to get your vaccine, please show up at that time. If you double book with us and with the Department of Health, for example, and you go to the Department of Health and don't let us know, we will have potentially wasted a vaccine scheduled for you for someone else. And when you're scheduled for your second dose, please get your second dose. Critically important, but please come at the time and place that you're scheduled for. And for some reason you can't, let us know right away. It is absolutely critical that we manage the storage requirements of this vaccine in such a way that we don't waste a single drop of COVID-19 vaccine. I can't tell you how proud I am to stand before you here today and tell you that since we started this in the middle of December, we have vaccinated over 10,000 individuals. Dr. Keel, you may have more recent numbers you can share with us, but the last I heard just a couple days ago was over 10,000. Again, our folks have just done an incredible job providing access to vaccinations and getting that vaccine out of the freezer into the arm as quick as we possibly can. So my hat is completely off to all the folks who are working really hard to do this. And we're beginning to already start planning for a wider distribution as more vaccine comes to us and as Department of Health allows us to move to the next prioritization phase. Just one other quick update. We have completely changed our website that provides you with all the statistics and data on the left side there. We will continue to provide you with the numbers that we see in our students and faculty and staff. For the last 22 weeks now, I have been providing every Monday a weekly video that sort of gives an update on where we are and provides some context in terms of the numbers. I will continue to do that throughout this semester. So please visit the website often and stay informed and stay tuned. We've also, on the right side, changed a good bit of information for our faculty, staff, and students. And please go to this website often to make sure that you have the most up-to-date information. So what's on your mind? And we know that these town halls are difficult because we call it a town hall, but it's not really a town hall in the true sense of the word. We don't have an opportunity for folks to gather here and ask us questions live, but we have tried to be as open as we possibly can, and we've received a number of questions. And I'm going to try to provide answers to a couple of those questions, and in just a minute we're going to turn it over to one of our medical experts here who can provide you with the latest information with regards to vaccinations. So let's try to dive right into some questions and see if we can provide you with the answers. There were some general questions about how we operate the university. There was a question about whether there's been discussion from the University System of Georgia or the Georgia Department of Health regarding shutting down schools again. And as president, keep in constant contact with the university system, with the chancellor. I was on a phone call with him just an hour before I came here. We're in constant communication, and he keeps tabs of what goes on throughout the whole state. If we ever got to a point where we thought things were turning to where we could not provide a safe and effective education, I'd be the first to raise the issue with the chancellor. We talked through that. But as a state, we are providing an open in-person education, and that's what the plan is. So yes, we are in contact with the system, but there are no plans at this point in time to change and go to a totally online situation. How are COVID cases handled on campus, like housing, et cetera? We have a fantastic student health center here led by Dr. Dollinger. He keeps constant tabs over the number of cases amongst our students, and he works with our folks in student affairs who also keeps a very close eye on how many we have in our dormitories and housing. And I'm in constant contact with those individuals as well. So we keep a very robust view on what's going on our campus, and it's managed through student health. On the employee side, it's managed through human relations and through employee health, and they help us keep tabs on the number of cases that we have there. Will the vaccine be required? And will it be mandated? And will it be mandated to either live on campus for our students, for our AU health system workers, or for faculty and staff? And the short answer is we have no plans at this point to mandate vaccine, mandate that individuals take the vaccine. We are strongly encouraging, strongly urging you that when it becomes available, take advantage of that vaccine. But as it is right now, we've not made the decision to do that. We're hoping that our folks would just step up and do the right thing and become vaccinated. And we're going to try to have a very robust education program like we're doing right now to provide you with information so you can feel good about getting vaccinated and realize that it is safe and right for you. But as it is right now, no plans to mandate it. The new variant of COVID-19, you've heard about this new variant of COVID-19 that appears to be more contagious, but it does not appear to be more serious in terms of its impact and effect on individuals. If we continue to do the things that we're supposed to do and have been doing for the last 10 months, wear a mask, wear it properly across your nose and mouth, Wash your hands and watch your distance. You should be just as protected from this variant as you are from the COVID-19 we've been dealing with all along. There's no indication that the new variant will impact you any more than the old variant if you do what we're supposed to do. Is there a plan to shift to more teleworking? We have always said that if teleworking makes sense for our departments, and they can do 100% business continuity in what they do, we want to encourage doing that, and we will continue to do that throughout this pandemic. We're going to get lessons learned from that. The post-COVID world will look different than the pre-COVID world, and some of that may not be a bad thing. But right now, our plan is to go back to an in-person, in-office experience. There might very well be some situations in which it just makes better sense to telework, and we want to give our managers an opportunity to be creative in that way. But right now, the plan is to come back to campus full-time. We should be now and in the future, but we'll consider innovative ways of doing business. Well, graduation being in person with guests, as you know, we made the very difficult decision to hold commencement at the end of the fall semester in December, but do it without guests. We felt that was the safest and best way to provide that experience for our students, and I think that was the right call. It's just too early to tell right now what May will look like. I certainly hope we'll be able to do commencement and have guests so that your family members of our seniors and our graduates can be present and participate in that. And we will do everything we can to try to get to that point, but we will also be mindful of the safety of our students, of our family members, but also our staff going that way. So please stay tuned. And will vaccine be made available for Somerville faculty and staff? And the answer is an emphatic, all capitals, absolutely yes. This is not just a vaccine for the health science campus. I know there's been a lot of focus on that, and rightly so, because it is our healthcare providers who have the greatest exposure to individuals that are known to be COVID-19 positive. We know that there are going to be issues. We know people are concerned. We know people want vaccine. We're doing everything we can to try to get this to you as quickly as we can while following the DPH guidelines. So this is not all health science. This is no Somerville or vice versa. We're going to try to get it to all of our faculty and staff and to all of our students and to family members as soon as we possibly can. Please stay patient with us as we work with the state to get more vaccine in so we can do just that. Now, at this time, I'm going to turn things over to Dr. Philip Keel. I've said many times, having an academic medical center puts us in the most enviable position of having medical experts, researchers, and scientists right here on campus. We don't have to go to Atlanta to try to get advice. We just have to walk across the hall to get advice. And we're delighted to have Dr. Philip Keel, who has been such an outward public face in terms of this pandemic. And he's going to be addressing some of the questions we got moving forward. So I'll turn things over to Dr. Keel as we open up some of these questions. We tried to group these questions together, and I'll kind of read them off quickly, and then we'll turn Dr. Keel loose on things. First off is it safe that AU Hospital still allows patients, one family support person to visit? And then along those lines, do we currently test all individuals who are hospitalized for COVID-19, or if not, should we be doing that?
Sure. So thanks, Dr. Keel, and thanks for the opportunity to help answer some of these questions that people have concerning COVID-19. The first one, of course, is it safe that AU Hospital is still allowing patients that are not those diagnosed with COVID to have a family member or support person present during the visit? It's important for us to remember that we have to balance out risk posed by allowing people into our facility with risk posed by not allowing people into our facility. So family members and support persons are an important part of the healing process. They're important members of the healthcare team. And for example, just imagine an elderly parent who you are the caregiver for, that you need to be able to help provide information about your family member's medical history as well as other aspects of their care while they're in the facility. As you can imagine, excluding those family members is actually detrimental to the care, not to mention the emotional aspects of not having family members or support persons present. So we are committed to our patient and family-centered care model. We manage this very carefully. We do a lot of screening of people that are entering our facility, and thus far, we have not seen a large number of cases of transmission from guests and family members to patients in our facility. There certainly have been a sporadic case here or there, but we monitor this very closely and enforce the universal masking rules in order to keep our patients safe. So we're committed to our patient and family-centered care. If we start seeing transmission from visitors to our patients or families, we will certainly reevaluate that in order to minimize those risks and keep our staff as well as our patients safe, but otherwise we intend to stick to those principles. The question about individuals hospitalized being tested for COVID-19, we actually test all patients being admitted to our facility for COVID-19. When they're in the admission process, we take precautions as if they are going to test positive for COVID-19, but then we test them and then cohort or group together those patients that are COVID-19 positive into COVID-19 units and those that are not onto other units. We also do pre-procedural testing for those patients that are entering our facility that are undergoing a procedure that could be aerosol generating and potentially expose others to the virus, and we are doing that universally for those patients. So we are doing an extensive amount of testing for patients being admitted.
There are three questions that are sort of related. One is, will vaccine distribution be prioritized based on the risk of your job function and not your employment platform? What about student teachers? I mean, we have vaccinated all of our healthcare students, but what about student teachers, and what do you think about the plans for that? And then when will the vaccine be available for the general public?
Sure. So vaccine distribution is done in accordance with the Georgia Department of Public Health guidelines. So they define what a healthcare provider is. And for example, when you look at concerns about students getting vaccinated, for example, but older members of the faculty, those that are over 65 not being vaccinated, that's because of the definition of a healthcare worker. So in the guidance that is developed at the federal level as well as the Georgia Department of Public Health, they define what a healthcare worker is, and that includes those students in those programs to be healthcare providers because of their potential exposures in the patient environment. So in order to train for any of our health professions, of course, you have interactions with patients, and therefore that poses risk to those healthcare providers in a way that is a greater risk than just a casual contact, for example, in a classroom or in other settings. So that's part of the reason those definitions were created that way. It is intended to be based on prioritization for risk of being exposed to COVID, and that is healthcare workers and those that support healthcare workers because of the chain of transmission from a patient to an employee who then exposes another employee throughout the system. So that's part of the reason for the prioritization. It has nothing to do with employment platform. When we have sent out announcements about this, we have tried to be explicit about defining these. As you know, sometimes it gets a little bit messy when you try to exact some of these definitions or try to define them. It's very difficult to parse that out, and that's some of the difficulties that we've encountered in this process. But the entire intent is that it will be based on exposure risk. In terms of student teachers, certainly those individuals are at increased risk. That's recognized in the vaccine deployment scheme, and that is the education sector. And in the education sector that are not health profession specific, those individuals fall into the 1B category. The education sector is spelled out explicitly in 1B. And for those that do not fit into category 1A, those education professionals will fit into 1B, and we certainly will be working aggressively to get those vaccines provided to those individuals as soon as possible. When it comes down to a vaccine available for the general public, that is a bit of a question mark in terms of what the vaccine availability will be. Augusta University and Augusta University Health have been working very hard to make certain that we're geared up to play a big role in this in terms of how we are able to support the community for vaccine availability. That is dependent, however, on the vaccine supply. And I'm sure if you followed any of the national news, you know that there are challenges with vaccine distribution. To put it in perspective, however, we didn't expect to even see a vaccine approved until at the earliest of March. So the fact that we're where we are is actually good news. The fact that we're talking about how we distribute vaccine and provide vaccinations to large groups of people that are at risk at this point is pretty remarkable. And so if we keep that in mind, maybe it'll help people understand that even though we've had challenges in vaccine rollout, to put it in perspective, to be where we are is pretty miraculous.
Excellent, thank you. We had a number of questions regarding vaccine safety and side effects. And first off, is the COVID-19 vaccine safe? And then what are the immediate reactions, long-term side effects? And if you have side effects, typically how long do they last? Is the reaction to the second vaccine injection more or less severe than the first? And then you can tackle those questions first. And there's also a question down here about the monoclonal antibody infusion treatment with regard to that. And I was going to pronounce bamlanivimab, and actually I think I got through that pretty well.
You did. You got it.
But first, address the issue of safety and side effects and the first versus second injection.
Sure. So the COVID-19 vaccine is very safe and effective. When we talk about vaccine safety, we grade any side effects related to those, but there is a category called serious adverse events. And in the large clinical trials that were conducted, these vaccines had significant demonstrated safety profile. And that is, although they have some side effects that do occur with vaccination, that the rate of serious adverse events is incredibly low, and in fact lower for many vaccines that we currently use routinely. So the vaccine is very safe. Although some people have expressed skepticism about the speed with which this was done, the reality is that the exact same safety measures that were used for verifying any other vaccine or documenting the safety of any other vaccine were also used in these vaccines. But think of it as just eliminating some of the wasteful red tape that has occurred with previous vaccine approvals. And a lot of the reviews occurred contemporaneously, rather than compiling a big report at the end and it's sitting on someone's desk for an extended period of time before someone decided to review it. So a lot of those wasteful steps were eliminated, but all of the normal safety checks and independent reviews that occur for any vaccine also occurred with this vaccine. Our experience here at Augusta University has certainly been that this vaccine is very safe. We have not had any serious adverse events reported. We have had some side effects related to immediate allergic reactions. That has been rare. All of those patients have done well. We have had side effects that have been reported from vaccination. I would say they're in keeping with to slightly above what was reported in the large clinical trials. However, that is not unusual whenever you start doing something like this on a much larger population. The immediate reactions are rare. They're exceedingly rare, but easily treated. And that is a very rare, and we've only had 1 or 2 cases that someone had an allergic reaction immediately to the vaccine that required treatment. But in all cases, those patients did incredibly well and with treatment had no difficulties after that. The long-term side effects are none. There's a lot of misinformation that's out there concerning potential long-term side effects. Now, it is hard to say conclusively that there are absolutely no long-term side effects to something like this. I will tell you, we do know that there appear to be significant long-term side effects from the COVID disease. And so when you're looking at this, the disease certainly has long-term side effects from what we've seen thus far. The vaccine does not appear to be, and in fact, most of the side effects appear to be mild and limited, with most common being pain at the injection site, some redness and soreness at the injection site, and then particularly after the second vaccination, since the body already is trained up to recognize the virus, that when you get the second vaccine, you've already got your immune system revved up with the first dose, that the second dose of the vaccine sometimes causes fever and chills that have lasted in some people, for the most part, about 12 hours. Some people it's 24 hours, generally no more than 3 days, where people have a little bit of fever and chills and some fatigue that occurs immediately following the second vaccination. It's important to understand that that's a side effect. It's not an allergic reaction. It is a side effect of your body's immune response to the vaccine. And in fact, you should view that as good evidence that the vaccine is indeed stimulating your immune system, and that immune system response is what causes you to feel that way. So it's important to kind of keep that in perspective. In regards to the question about the second injection versus the first, we do see those side effects being a little more pronounced in the second injection, and that is because we've already revved up the immune system the first time, and when someone gets the injection the second time around, the side effects become a little bit more pronounced for some people in the second injection. In regards to monoclonal antibody therapy, or bamlanivimab is one of the drugs that we're using here. The others has a brand name called Regeneron that we're not using extensively right now, but we are using a lot of bamlanivimab. That is a monoclonal antibody therapy that can be used for someone that is diagnosed with COVID-19. If you have COVID-19 and are high risk, we use this therapy to essentially give your body a chance to catch up. So it is a man-made antibody to the virus that helps to knock down, so to speak, the amount of virus that a person has in their body. And in doing so, it gives someone a chance for their own natural immunity to kick in to the virus. When someone gets that therapy, whether it's either of the two monoclonal antibody therapies, or if they're critically ill and get convalescent plasma, we call that passive antibody therapy. And that passive antibody therapy, or monoclonal antibody therapy, can reduce the effectiveness of the vaccine if it's given in immediate proximities to that. So for that reason, people that have had monoclonal antibody therapy should wait at least 90 days after their disease in order to make certain that they get the effectiveness from the vaccine. Additionally, I add to that, people that did not require monoclonal antibody therapy but do have COVID-19, we are now recommending that they consider delaying their vaccination for 90 days after their infection. One, because we know that people don't get reinfected in the first 90 days. And two, because we think that that may reduce some of the side effects from people getting vaccinated who have already, their immune system is already trained up somewhat to recognize COVID-19.
Great, thank you, Dr. Keel. And just to remind people, you know, I focus so much on the great advantage of having the academic medical center here with regards to testing, but I think we sometimes overlook the incredible advances we made in the treatment of COVID-19 just in the short while that this disease has been around. Monoclonal antibody treatment is one of those that we're state-of-the-art right here, being able to provide that, and it is already having a very, very significant effect. All right, I'm going to move to a couple more questions for Dr. Keel here. This has to do with vaccine administration and access. As a retiree, a senior citizen, when can I get the vaccine? Where do I go for the vaccine, and how will I be notified? If I get the vaccine at a community-based center who's tracking the results, Will members of the black community be given equal access to the vaccine? And then what is the plan for AU Health to begin vaccinating their primary care or clinic patients? And will priority be given to medically fragile patients or patients with a number of comorbidities? So a lot of questions there, and I'll have you kind of put those together how you think is best to answer.
Sure. As a retiree or senior citizen, can you get the vaccine? Yes. The entire team is working very hard, again, dependent upon vaccine availability, to make certain that we have a very scalable mass vaccination effort in partnership with the Georgia Department of Public Health. As many of you know, we have been supporting the Georgia Department of Public Health. Our students have been volunteering there. Some of our faculty have been volunteering at the Georgia Department of Public Health and supporting their vaccination efforts as well as our vaccination efforts here. As soon as possible, we would like to start vaccinating those at-risk individuals, and certainly want to make certain that our retirees and senior citizens that are affiliated or associated with or prior association with Augusta University have the opportunity to get vaccinated as soon as possible, as well as our community at large. So the team is working very hard to make certain that we have an effective strategy to be able to do that in a manner that allows our patients as well as our employees and retirees access to get vaccinated in a smooth, efficient, safe manner as soon as possible. And I'm hopeful that we'll be able to make some announcements about that very soon. In terms of where you can go for COVID-19 vaccine right now, we are still vaccinating employees and health profession students who are in those categories that we've identified because of their job and support of the health system or other factors at the professional building, one location, but we're doing that by appointment and in a very orderly fashion as those slots become available. As more vaccine becomes available and we expand groups that can be vaccinated, you'll be notified by email of the opportunity to sign up for vaccination. Our team has developed an incredible system that we hope to be able to launch soon that really streamlines that registration process and makes it easy for people to sign up for an appointment for the first vaccination as well as the second vaccination. And we're looking forward to potentially being able to launch that soon, as well as give announcements about where those vaccination locations will be in very soon. A comment about where you can currently be vaccinated. If it's not in our location that we're currently conducting here right now, there are other opportunities in the community where you may qualify for vaccine. For example, the Department of Veterans Affairs is continuing to vaccinate their patients as well as their employees. And for those that have prior military service and have a DD-214, the VA can provide vaccination, and I would urge you to consider that route. Additionally, the Georgia Department of Public Health is operating a very smooth, well-run drive-through vaccination location in downtown Augusta at one of the schools that can provide vaccination, and that's an online sign-up process, then followed by a phone call back with a confirmation of the date and time of vaccination. We are continuing to work on this plan to make sure that we expand those opportunities and to be able to provide additional opportunities to vaccinate as soon as possible. For those that are vaccinated in other locations, that data is required to be reported to the Georgia Department of Public Health and be able to track those vaccinations. And each of the vaccination sites reports that data back to public health. You might have heard on the news that there are issues about using vaccine that's allocated for Georgia, for South Carolina. We're working with the Department of Health and Environmental Control in South Carolina to see if we can get allocations of South Carolina vaccine so that we can vaccinate our South Carolina patients and our employees and those that are part of the Augusta University family that qualify in South Carolina at a location there. Regarding the question about members of the Black community given equal access to the vaccine, Augusta University and Augusta University Health are making certain and working to make certain that we have access available to those that are most at risk. As you know, COVID-19 has disproportionately affected communities of color. The Black and African American community, and early on in this pandemic, was disproportionately affected by this. And we also recognize that access to the vaccine is going to be critical. The team has been working very hard, and our colleagues in the Medical College of Georgia and the Georgia Prevention Institute, Dr. Martha Tingen, Justin Moore from MCG, have been working very hard to make certain that we've got a great interface with the Black and African American community to make certain that we provide any education or resources that are necessary, as well as tangible efforts to make certain that we are providing vaccine in locations that are advantageous to those communities, as well as providing access via multiple means and communication channels. So we're very committed to make certain that we have adequate opportunity and access for individuals of particularly disproportionately affected communities. Regarding the last question, and I believe you covered this one already, what is the plan for vaccinating our primary care or clinic patients, and what priority will be given to medically fragile patients? In this early phase of the vaccine, remember, vaccine phases are divided into 4 phases. People commonly talk about phase 1, 2, 3, and then phase 1 has A, B, and C within it. We're in phase 1A. Phase 1B would be the essential workers and the education section. 1C steps down from there. But phase 2 of the pandemic is that the vaccine becomes more widely available. When we're in a very vaccine-restricted environment, it's important that we make certain that we maximize every single dose of the vaccine. Dr. Keel mentioned that there's unique storage requirements for each of these vaccines. Because of that, once the vaccine comes out of the freezer, there is a specified time that it's allowed to thaw, and depending on the vaccine, it can only be used for a certain period of time after that. Once you open a vial and you draw doses out, depending on the manufacturer, there are only so many doses you can get out of that vaccine, but you can't cross vials, et cetera. It's all very complicated. Our team thus far has not wasted a single dose of vaccine. The incredible pharmacy team and other healthcare providers that we have treated this like it's liquid platinum, not liquid gold, in that they are making certain to utilize every single dose. In a vaccine-limited strategy, that becomes very difficult to do in a clinic environment where you may have 1 or 2 vaccinations occurring for that day, or potentially more. But again, distributing that vaccine, given the storage requirements, the security around that, the potential for doses to go to waste if you distribute that in multiple locations, is what we're avoiding at this point. Because of that, we're choosing to centralize the vaccine supply to make certain that we use every single dose possible and that none goes to waste. As additional doses become available, and as we start transitioning into phase 2, we will deploy vaccine to locations to kind of normalize vaccination of our patients, like we would influenza, for example, if we're trying to vaccinate people for influenza. So right now, we're not going to have a widely deployed strategy of sending a vial, for example, where it could have a couple of doses used out of it and potentially waste others at this point. But at some point in the future, we will do that. The medically fragile patients are included in that, in 1A+, if they're over 65. Those with chronic medical conditions that are at risk are included in phases 1B and 1C. And so they are prioritized for vaccination, but we will maintain that centralized as of right now, but at some point in the future, we'll decentralize that.
Very good. I had a number of questions regarding the COVID-19 vaccine and other vaccines. So pros and cons of getting the COVID vaccine versus the flu vaccine. You mentioned influenza. Should you give both vaccine and flu vaccine or either one? If both are done, how much time should you space apart the vaccines? And how much time should lapse between getting another vaccine other than flu, like the shingles vaccine, for example, and the COVID-19 vaccines? All these questions kind of relate to COVID-19 vaccines in relation to other vaccines.
Sure. So in regards to flu vaccine versus COVID-19 vaccine, two different diseases. They mutate at different rates, two different impacts and clinical courses. Although we draw analogies between the two in relation to the importance of vaccination, et cetera, they are two separate and distinct diseases that need two separate and distinct vaccinations. They should not, however, be given together and within 14 days of each other, and that's simply just because of the lack of data about any potential issues that could arise from that. The flu vaccine requires a multiple formulation every year because of the rate at which the flu virus mutates. COVID-19 does not mutate quite as fast as the flu virus does, and because of that, right now, one COVID vaccination course of 2 doses appears to be effective against all of the currently circulating strains of COVID-19. The flu changes every year. We see flu strains that develop each year as well as some that come and go. And the flu vaccine every year is formulated based on what we see circulating in the southern hemisphere during the summer. We then formulate what the flu vaccine will be for the winter. So I would encourage people to get both. We don't yet know if the COVID-19 vaccine will be a yearly shot. I suspect that it will not be. But I would urge you to get vaccinated for COVID-19 now. We've luckily not seen much flu this year. I hope that that continues. But then come around flu season next year, you will need to get an additional flu shot. Again, they should be separated by 14 days. In terms of getting the two of them, again, they should be separated by 14 days. If you've not gotten your flu shot yet, certainly if you know you're going to have 14 days before your COVID-19 vaccination, that's fine to go ahead and get that. Don't get it between the 2 doses. In terms of how much time should elapse between getting the shingles vaccine and COVID-19 vaccine, the current spacing recommendations is that you not get any of these vaccines within 14 days of each other. So we don't recommend that you're getting the shingles vaccine 14 days. You need it at least 14 days prior to getting your COVID-19 vaccine, and you should not get any vaccinations between your first dose and your second dose of COVID-19 vaccine.
Great. Thank you very much. And a question about virus protection, antibody production. After the first injection, how soon are you protected? If you have had COVID-19, should you get the vaccine? And how long after the illness should you get the vaccine? Once you've been vaccinated, do I still have to wear a mask and socially distance? And then an ancillary question, someone asked about donating blood after having been vaccinated. So if you could address those for us, please.
Sure. So after the first COVID-19 vaccine injection, you should continue to act as though you have no protection at all. And that is because although we know that there is some protection afforded by the first vaccine, that's not the way, the first dose of the vaccine, that's not the way it was studied. And so we need to go based on the evidence. We do know that in most of the participants, there appeared to be about an 80% effectiveness at following the first vaccination after a couple of weeks, after about day 12, actually. However, it's important to know that that immunity and that effectiveness trails off and appears to drop back down at about day 21 or 28 or so, if you're talking about Pfizer, for example, 21 days. And that's why we give that booster shot at that point. So it's important that people understand that just because you get the first vaccine, you really should not change your behavior, and you should consider that you are not protected after the first dose or the second dose, but it does appear to afford some protection. In terms of getting vaccinated in relation to COVID-19 illness, I mentioned this earlier. Our current recommendation is that you wait 90 days after a COVID-19 illness, and that is a clinically apparent case of COVID-19 with a positive test. The reason for that is because your body develops immunity on its own, and that immunity stays elevated when you develop antibodies for a period of a couple of months. We do know that it starts to trail off in some people a little bit after 3 months. But in our experience here, what we've seen is that people that have had more side effects from the vaccine have been vaccinated in close proximity to a COVID-19 illness. And that, plus the monoclonal antibody therapy, is part of the reason that we recommend spacing that out. Additionally, reinfections are essentially unreported in the first 90 days. So really someone that's had clinically apparent COVID-19 as evidenced by a positive test plus symptoms, really we don't see reinfections in that first 90 days, and therefore the reason for spacing that out at 90 days. Once you've been vaccinated, you have to still wear a mask. The answer is yes, and there's two reasons for this. One is we haven't proven that it's not possible for someone who has been vaccinated to be an intermediary to someone else of the virus. In other words, it's possible. I think it's unlikely, but it is possible that even though you have immunity and have developed immunity, that if you were exposed to the virus, that you could carry it and then transmit it to someone else. So to protect those at risk that may not have been vaccinated, you still need to wear a mask, especially until we prove essentially that those people aren't capable of transmitting it. But the other is actually a very practical measure, and I've predicted this before, and that is if we suddenly said if you're vaccinated, you don't have to wear a mask anymore, I imagine a lot of people would suddenly become vaccinated overnight because nobody likes wearing a mask. We understand that that's not pleasant, but they do work and they are effective. And so the other is a very practical issue of we can't drop mask mandates yet, even with people vaccinated, for both of those reasons. One is we need to prove it scientifically, and the other is just a very practical measure. And then why can't you give blood if you're vaccinated? As you can imagine, the blood supply is very critical. And one of the issues that can happen with the vaccination is that your body revs up its antibody production, et cetera. Until they study what kind of inflammatory markers that people have, remember, we're giving blood to critically ill people, and setting off kind of an inflammatory response in that individual could be bad given their clinical situation. And so blood banking and the blood supply has to be managed very carefully. And so I'm sure that people will be doing studies on the blood of those that have been vaccinated to measure all of those inflammatory markers and other issues that may occur with vaccination, to make certain that when we give someone a unit of blood, that it is safe and does not cause any potential harm to that individual.
Very good. Well, Dr. Keel, thank you so much. That was an awful lot, I know, but I think you can fully appreciate, again, and I hope you don't get tired of me saying this, because I'll never get tired of saying it, is that we are so fortunate to have folks like Dr. Keel that are part of our university. Right here on our campus, and Dr. Vasquez, and a whole slew of other experts in this field and other fields. And this is just another great example of having that expertise right here can hopefully provide you with state-of-the-art questions that you may have. So thank you very much for that. We appreciate it. So what about tomorrow? I mentioned there's light in the tunnel, and I think we're not through this yet, and we know that we can't let our guard down. We can't take our foot off the gas. And we're not going to be able to for a time yet. But I do think as a university, it's time we started thinking about what tomorrow is going to look like. We've had our strategic plan, Beyond Boundaries, is winding down. It was a 5-year plan, intentional. We're getting close to that time being up. And I think it's time now for us to think about a new strategic plan. As we start getting out of COVID, what a great opportunity for us to get energized and excited about what the future is going to look like. A new provost is here with fresh ideas and enthusiasm about what the university needs to look like as well. And I think it's the perfect storm of all that coming together for us to begin to start thinking about this. Now, I get asked a lot, President Keel, what's your vision? Well, obviously I have a vision, but I can't make the vision for this university. That's something we're all going to have to do together. It is a combined effort of all of us because it takes us all to make what Augusta University is and what it can be. But let me just give you some of my general thinking. Here's what's swirling around in my head now with regards to what our future looks like and what we might be able to do as we move forward. You've heard me say this many, many times, and I hope that if you've not heard it, you're going to hear it now. We have one priority at Augusta University, and that's our students and our patients. Everything we do revolves around both our students and our patients to provide an outstanding first-rate education and the highest quality care for education for our students and the highest quality care for our patients that we possibly can. So anytime we move towards a new strategic plan, this is going to wind up being the foundation of everything that we do. But in terms of students, we have got to be mindful of enrollment and all the things that manage on that. Having a robust enrollment year after year is hugely important. This graph just shows you over the last decade what enrollment has looked like. In the first 5 years of that decade, we had a year-over-year decrease in enrollment of about 3%. Starting in 2015, we did an about face, and we have had a year-over-year increase in enrollment of about 3% every single year since 2015, and had record-setting enrollment this fall in the face of a pandemic. So we're doing all the right things. We just got to continue to do that. We got to find a way to cast that net much broader and wider than we're currently doing, and make Augusta University the destination site for students across our whole region. Along with that, we've also got to be focused on student success. It's one thing to get students to come in through the front door, but we want to keep them here for 4 years, and then get them out the door again. So we need to, whatever we do moving forward, we've got to come up with creative and innovative ways to keep our students engaged so that they can be successful and get through with their degree out the door in 4. We are the state's dedicated health sciences medical college. That is in the bylaws of the University System of Georgia. Of the 26 campuses, we are the only university that has a medical school, a dental school, and a health system. And that puts us in a very unique position. We have got to take advantage of this designation. It makes us unique and gives us incredible opportunities to market Augusta University throughout the entire country as being a destination place and take advantage of this. And this is something that the entire campus can take advantage of. This is not just a health science campus aspect. It's the entire university aspect. And I think we need to start thinking of even more creative ways than we're already doing. And believe me, we've got some incredible, innovative faculty who have already latched onto this and taken advantage of this. We've had great experience in terms of taking our curriculum and putting it online. When I'm talking out of both sides of my mouth a little bit because we're dedicated to an in-person education. That's who Augusta University is. But we've got to make our education available to all types of students. And some of those students that just don't have the opportunity to come to a classroom. I'd like to see us have every undergraduate program, every undergraduate course we have offered every semester that it's offered as an online and an in-person opportunity, so students can choose what is best for them at that point of time in their life. What an opportunity that would be for us to dramatically increase our enrollment and opportunities we present in doing so. I've already talked to Dr. McKinnon about this. He's excited about this too. He already has ideas on how best to do this. So let's take advantage of the great innovation that our faculty have been doing through this pandemic and flip that on its ear and be able to offer this moving forward. Research. We are one of 4 research universities in the state of Georgia, and we are nowhere near where we need to be in terms of research. And so we're going to be focusing heavily on making strategic investments in research so we can move forward. This past year, our NIH funding increased by 25% compared to the year before in the face of a pandemic. We've already got a tremendous bit of momentum here. We need to capitalize on that and keep that going. And in addition to just research, creativity as well. Again, let's find ways to bridge art and science. Let's find ways to bridge humanities and medicine in very creative ways, take advantage of who we are and what we are now, and do it in ways to make this sort of creativity, this sort of scholarship, this sort of research available to all. We're the state's only public academic medical center, and we need to take advantage of that, as we have throughout this pandemic. The governor of the state of Georgia called us to help him get testing throughout the entire state. He sees us as his university, as every citizen of this state of Georgia should. We are the state's, the people's university, the people's medical school, the people's academic medical center. We got to find ways to try to capitalize on that and advance this as well. And oh, by the way, we're just on the verge of being able to open a hospital in a neighboring county, the largest county in the state of Georgia without a hospital. Think of how we can take advantage now of building an innovative 21st century hospital right in the county next to us. So I see that as being a huge part of what our future looks like. We've got to do a better job of providing enrichment and engagement for our faculty and staff. How do we provide professional development for our faculty? How do we provide leadership opportunities for our staff so that we can grow our own future leaders right here where we are and do the same thing for our faculty? How can we have a more diverse faculty by recruiting young trainees and then promoting them, fostering them, getting them a productive environment so they can become our faculty in the future? And we got to find real creative ways in which to do that. And we have got to be the place that we all say we want to be. We've got to be a more diverse institution. We've got to be a more inclusive institution for all peoples of color, of race, of creed, of religion, of way of thinking, of geography. And I'm committed to doing just that with your help. So an awful lot more to come. That's just a highlight of some of the things that's rumbling around in my head. I'm excited to know what's on your mind. And as we begin to start thinking about what a new strategic plan will look like, well, I want to have a process where every single one of you will have a chance to feel like you're really engaged in this process, because we need this to be our plan. We don't need this to be my plan. So stay tuned. A whole lot more to come, and I'm really, really excited about that. The only thing we know is going to be constant over the next period of time, 6, 8, 10 months, is change. I know you're tired of hearing that. But this is where we are. We have taken a leadership role in showing the rest of the state and indeed the rest of the country how you react to change and how you do it with a positive attitude and how you do it not only at the expense of our mission, but how do you do it to promote our mission? And I could not be more proud to be part of this team. We're going to have to remain nimble and flexible. And I know you're probably tired of hearing that too. I certainly am. But those of us who can be the most nimble and the most flexible, the institutions who can, will be the leaders of tomorrow. And as we get into this next year, as we get into this next decade, we have a chance to really show the rest of the world how it's done. Please continue to practice the 3 W's. Wash your hands, watch your distance, and wear a mask. It really is just that simple. We're not out of the woods yet, but there truly is light at the end of the tunnel. So thank you all very much for being here with us today. Again, Dr. Kuhl, thank you so much for your expertise and sharing that knowledge with us. Dr. McKinnon, it's a real delight to have you here with us, and we'll look forward to your leadership and to your vision as we map our future together. Thank you so much. Stay safe and go Jags!